Today on SUTV News Special Report, we take a look at an STD on the rise since 1995.
We examine what the disease is, why the rates have been rising, and what we can do on campus to prevent the spread.
It's all coming up right now. Welcome to SUTV News. I'm Zach Salzgiver.
And I'm James Bailey.
The STD chlamydia is so common it's likely on your walk across campus. Today you've passed someone who's been infected. Since 1 in 50 20 to 24-year-olds has had it. Eric Davies has more.
More than 1 in 500. More than 3 in 1,000. This is the 2015 rate of chlamydia for Cumberland County. The rate of the infection is rising all over Pennsylvania. From 1995 to 1997, the chlamydia rate of infection in Cumberland County was 3 in 5,000. By 2004, it more than doubled. The CDC states young adults are most at risk.
I can tell you we do see at least probably 2 or 3 diagnoses of chlamydia a week that we see here, but not everyone comes to for treatment here.
The quarter in the center of this group of pennies represents one 20 to 24-year-old with chlamydia.
There's cases that are silently being passed because someone may not have active symptoms when they have the infection.
The passing of this infection through these silent cases could be one reason for the rising rate.
Mutually monogamous relationships are less risky than if you have multiple partners. I mean, that's pretty common sense, but I think that's probably why the numbers are still climbing.
But even monogamy isn't entirely effective when it comes to stopping the spread of this disease.
We see students sometimes that will say their partner has chlamydia. They know they've been exposed to chlamydia, in which case we treat regardless.
The statistics are that, if a female has had chlamydia, a quarter of those females will get reinfected within that following year.
Lack of communication between sexual partners can lead to passing of the disease between the two.
It's like playing tennis is what I usually tell my patients, that if one person X is treated, but Y didn't get treated, and they're obviously sexually active together, it's just going back and forth.
Another possible reason chlamydia rates are rising may be the use of new screening methods.
And I feel that since it's becoming more easily to test, and the testing itself is easier to bear and go through, I feel that more people are more willing to be tested, and there's a possibility that we're seeing more cases because we're perhaps screening better.
Other factors can also affect the chlamydia rate. Let's head back to the desk for more information.
Chlamydia does discriminate. Factors like sex, age, race, and even where you live change the likelihood in which you could contract the disease. In 2015, African American men and women had the highest rate, with more than 1 in 100 with the infection. Hispanics fared a little better on this, with a little under 1 in 250 being infected. Whites have lower rates still, with 1 in 500 being infected. The lowest rate belongs to the Asians, with a rate of only 1 in 1,000. When we come back, we'll dive deeper into what chlamydia is, as well as some more specific rates. Stay tuned.
Of all the things you've done with your bike, donating it to Goodwill may be the most incredible of all. Your donations help fund job placement and training for people in your community, which means your stuff can be more powerful than you think. Goodwill. Donate stuff, create jobs.
Welcome back. Now let's head over to James with more information on chlamydia rates.
The categories of age and sex both have an effect on chlamydia rates. The rate of chlamydia was the highest in young adults, aged 15 to 24.
Into smaller groups, the rate among 15 to 19-year-olds was 1 in 55.5, and the rate among 20 to 24-year-olds was 1 in 39. Sex can also influence your chance. In 2015, the rate among females was a little more than 1 in 155. The rate among males was less than half of this, with a mere 1 in 327 being infected. When the rates of age and sex are put together, the highest rates belong to young females. The rate of chlamydia among 15 to 19-year-old females in 2015 was 1 in 33. And the rate among 20 to 24-year-olds was 1 in 27. The rates among men of this age were substantially lower, with the highest belonging to 20 to 24-year-olds with 1 in 68. These rates take on a greater meaning when we take a look at what chlamydia actually is. Eric Davies has more.
Chlamydia is an STI, or sexually transmitted infection, caused by bacteria transferred during sexual contact.
The misconception is that that you can only get it from penetrative intercourse, but that's not true. So other sexual activities, you can still get this infection.
According to the Pennsylvania Department of Health, more than 3 million people contract it annually. The infection may move inside your body if it is not treated.
For a female, it can be something as severe as infertility, pelvic inflammatory disease, and that may even require surgery, hospitalization for antibiotics, things like that.
The disease can also impact infants born to a mother with chlamydia.
Let's say a woman had it and she had a vaginal delivery of her baby. That can even cause the baby eye infection, pneumonia even.
This infection can also be hard to spot.
It can cause an infection where symptoms may not be noted. Men or women may actually have had contact or have the infection of chlamydia and not know it and not have any symptoms at all.
This infection can have serious effects on both the people who get it and their loved ones, making it something to keep an eye on. Eric Davies, Special Report.
Apologize one moment. We have some technical difficulties here. SUTV. Your chances of contracting chlamydia also change based on where you live. People living in the Philadelphia County, the largest urban center in Pennsylvania, were twice as likely to have chlamydia than people in Cumberland County, the suburban county where Shippensburg resides. The trend prevails throughout Pennsylvania's counties, with the metropolitan areas reporting higher chlamydia rate than rural areas. Now, back to the desk.
When we come back, we take a look at what we can do as students to help protect ourselves from this infection.
Of all the things you've done with your bike, donating it to Goodwill may be the most incredible of all. Your donations help fund job placement and training for people in your community, which means your stuff can be more powerful than you think. Goodwill. Donate stuff, create jobs.
If you're going to be sexually active, it is important to stay safe and use protection.
The recommendation I can give is to make sure that there's some sort of barrier method. So wearing a condom.
While the use of condoms can reduce the risk, it is not 100% effective.
Condoms will decrease the risk, but I think it's very important to emphasize that when it comes to chlamydia, condoms don't necessarily make sex safe. They're only about 50 to 60% effective at preventing the transmission of chlamydia during sex.
Condoms are for sale on campus in the Cub at the Snack Shack, as well as in Eder Health Center. One of the possible reasons for the rate increase is the lack of proper screening. Dr. Connor advises all sexually active females who are above the age of 19 to start getting regular pelvic exams.
OBGYN, as we're doing the pelvic exams, we can go ahead and swab and screen for gonorrhea, chlamydia, and that's something that females should do on a yearly basis.
Right. Dr. Wellman would also like to reassure males the screening process for chlamydia is quick and non-invasive.
We hope you have found this SUTV News special report very informative.
Follow us on Facebook, Twitter, and Snapchat, and check out SUTVnews.com for more stories. We'll see you next time.